welcome back to Pelvis Party. My name is Becky Monpetit. I am the owner of Rochester Local, and today I am joined by a special guest as well as our regular co-host. This is Dr. Braun. She is the chair of the Obstetrics and Gynecology department at Olmsted Medical Center, and you've seen Britt Marschall before. She's with Communications and Marketing at Olmsted Medical Center. Hello.
Hello.
Welcome back.
Thank you.
So excited to have you. So last episode we talked a lot about periods, and this episode we're going to talk about hormones.
Love them.
Right? Hormones. I think it's just kind of like this topic that we say, right? Like, hormones, I'm feeling hormonal, I'm feeling, these sorts of things. But do we even realize what that means and how they play into our day-to-day lives? So we're going to talk about hormones. Let's just start. I don't know. Big topic.
Okay.
You go ahead.
Wow. Well, yeah, it's something I get asked about a lot, and it's a very good topic, right? And it affects kind of everything. And I feel like there's a lot of research even going on right now as we speak as to how different hormones are playing a role. For example, even like vitamin D.
Yeah.
We call it a vitamin, but we're finding that it almost acts like a hormone.
Oh,
it's very interesting.
That is fascinating.
Exactly. And we don't even, I feel like we don't really know all there is to know yet. So it's exciting.
Yeah.
But a great area of research. So, but I do get asked that a lot. I have patients coming in, they're like, well, I just feel off. Do I have a hormonal imbalance? And can you just check all my hormones? I get that question a lot. But usually
is there a test for that?
Yeah.
Yeah. So there isn't really a panel for like just checking hormones really. But with when it comes to your gynecologic health, generally we just want to know more. Like what is particularly bothering you?
Yeah.
What are your symptoms? Is this a is it a premenstrual issue that we're having, right? Right before my period, I'm getting really irritable, abdominal bloating.
Yeah.
Lots of breast tenderness.
Yeah.
Kind of those symptoms where it's, very cyclic.
Yeah.
Or is it more of a, gosh, I just really can't lose weight. I'm constipated all the time. I feel cold all the time, looking almost of like a hypothyroidism, underactive thyroid. So I feel like the word hormone itself is kind of hard to identify what the patient means by that.
Right.
So digging in a little bit deeper, trying to figure out what exactly the issue is. Or is it a matter of, well, I really want to have a baby and it's not happening and I feel like my hormones are off. And so, which is kind of a separate issue.
Yeah, right.
Yeah.
So when you break it down, a hormone, and we have lots of them, right?
Right.
A hormone is essentially a trigger in your body that tells your body to do something.
Exactly. Yes.
Okay. So your body releases X hormone and tells the egg to travel, right?
To do something.
To do something. Right. And then there's more hormones that tell it to embed or not embed.
Yes.
Right? And then there's a hormone that tells your body to flush.
Yep.
And that would be a period.
Right.
Right?
Right.
So these hormones can get out of whack in your body through different things, either stuff that you can control or can't control.
Exactly.
Right? So how would you explain to someone, or if someone is watching this right now and thinking,
yes,
do I have an imbalance?
Right.
And so I know you talked a little bit about, how, cyclical and these sorts of things, but what are something else? Let's say somebody is either in their mid 40s or 50s or maybe approaching menopause. Like what do they need to look for to come in to see you?
Oh, good question. There's a couple of things I wanted to touch on quickly about what you had just said.
It was a loaded question.
It was a lot of things. It was so much good stuff. There was a lot of good stuff in there. But you're right. It's hormones are cyclic in females. And so, we can't just do a hormonal check at any specific time.
Yeah.
So if I'm checking, for example, the follicle stimulating hormone or FSH level, that's going to be the hormone that's telling the egg, from the ovary, yes, I want to ovulate or you should be released. So if we're checking that, usually, we want to check it at a very specific time in your cycle. Same with your estrogen and progesterone. We like to check those at specific times too. Just because that's when the research has kind of given us good targets
Yeah.
because they're fluctuating all throughout your cycle. And so we don't really have good reference ranges, I guess you could say, or for the whole cycle. But we
Okay.
know cycle day 3, it should be this, you know,
Mhm.
cycle day 21, it should be this. So things like that. So if you're coming in for a hormone check, it'd be a red flag to me if the provider was just like, oh yeah, we'll do the full workup today, because usually it's going to be timed with your cycle.
Okay.
And
So
then
that could be a series of appointments.
it could be, yes, like, oh, we'll have you come in this day and then this day. And then back to the original question, which I already, when to come in? Okay.
You got it. I know. I'll break them up next time.
What's a red flag?
Yeah.
Really, if it's anything where you feel something is happening cyclically, whether it's mood-wise or symptom-wise, seems to be related to your menstrual cycle and it's affecting your daily living. So like, gosh, you know, a week before my period, I just, you know, yell at my partner or husband and it seems very irrational, and it's, you know,
Yeah.
a week before my period, I'm like getting into these fights or arguments, or I'm super anxious, I can't sleep at night, insomnia can sometimes happen. Once it gets to the point where you're seeing it impacting, that's a good time to come and see us and try and figure that out. Or, you know, with especially with perimenopausal symptoms, that can be really tricky, because then it might not be cyclic, right? Because your body is kind of at the point where you're not necessarily ovulating regularly.
Sure.
And so you might skip a cycle or two,
Okay.
which is totally normal. So that can be a little bit harder to gauge. But if you feel, you know, with those symptoms, usually it's going to be, when it comes to bleeding, it's kind of easier to describe. So if you're having prolonged bleeding, so if the cycle is lasting longer than 10 days, I usually say that's a red flag. Heavy bleeding, which would be, in general, soaking through a pad in less than an hour, or having those larger size clots, which we talked about in our last episode, or if it's too frequent. Those are the red flags. Too frequent of bleeding, meaning you had a cycle, it finished, and then 2 weeks later, or less than 21 days of a cycle, basically, which would be day 1 is the first day that you bleed. 21 days later, having another period or less would be too soon.
Too soon. Okay.
But yeah, usually the perimenopausal bleeding, those would be the red flags. But yeah, also with perimenopause, you know, other symptoms might be just fatigue, weight gain, again, mood changes, sleep changes. Really, when your symptoms kind of start affecting your daily life, like I said before, that's when we would want you to come in and talk to us about it. And some of it's going to be, yep, that sounds normal, and you know, we can kind of troubleshoot with simple things, simple management options. Whereas other times it might be, okay, we do need to actually check your hormones.
Right. Well, 2 things that I thought of as you were talking. One is that sometimes women will say to themselves, at least I do, oh, that's probably normal. That's probably normal. You don't need to, no, go in and ask, right? We don't know. We're not physicians. We're not the one with the knowledge. So sometimes I can normalize a symptom or something that I'm experiencing away. And that's not what we want, right? We don't want to settle, as we say. And so don't be afraid to go and see your physician or your primary, even if it turns out to be normal. It's okay, right? It's okay. It's better to know, not let that percolate in the back of your mind.
Right. There's like that fear of not knowing, that fear of, oh, I'm going to sound silly. Like, why am I asking this question? It's probably fine.
I'm embarrassed to sound like I don't know what I'm talking.
Yes.
You know, all that. Just cut that out.
Right.
And then that kind of leads into another thing that you were saying is about how hormones can affect our well-being. So it can affect things like waking and sleep cycles and these sorts of things. And that can affect your mental health, right?
Yes, exactly.
So hormones and mental health can play a role together. And so maybe you can just talk a little bit about that and how you don't want to ignore signs like that either.
You don't. And that can be really hard for patients too, I feel like, especially when, you know, well, 3 weeks out of the month, I'm fine, you
Yeah.
know, and then I have my period and it goes back to normal.
Yeah.
I'm doing well.
Yeah. Yeah.
And I think you're right when it comes to kind of sleep and hormones and mood. I mean, they're all interrelated, and sometimes those are ignored or downplayed.
Yeah.
And it can be difficult to admit you have a problem with that,
Yeah,
right? And
Right.
that
You
you're
have
not.
to talk about, yeah.
Yeah, exactly.
Because you want to seem like you're put together and everything's good. Like
Right.
we do. We just kind of
Right.
stuff it down.
Right. Is
Yeah.
exactly right.
So-
Exactly. So it can be an issue, but I feel like we do have a lot of good treatment options too for, especially, you know, if it seems to be cyclic, it's really interesting. So it doesn't even mean that you would have to be on an antidepressant every day. You
Yeah.
know, there's hormonal treatments, but also it's really quite fascinating. Some antidepressants, anti-anxiety medications, when you take them just for those 2 weeks before your period, are effective.
Oh, wow.
So you don't even have to take a medication all of the time,
Mm-hmm.
which I feel like is more normalizing as well.
Oh, sure.
You know, just like, well, this is when I'm having the problem.
Sure.
So I'm going to take the medication when I have the problem. So it's kind of, well, it's easier for patients. However, some patients are like, well, I can't cycle track. You know?
Right. Sure. They just,
You
yeah.
can take it every day too.
So there's just
Whatever fits.
yeah.
But there's options.
There's lots of options. So something that I've heard about and have friends that have had this condition is PMDD, premenstrual dysphoric disorder. Is that right?
That's right. Yes.
Okay. So can you talk a little bit about that?
Right. And I feel like that's kind of what we were kind of alluding to, right? Is that if you have these symptoms, they seem to be cyclic right before your period. Typically, it's going to happen if you're tracking ovulation, tracking cycles. It's after you ovulate, a couple days later, you know, your hormones are kind of dropping.
Mm.
And so that's when these symptoms can arise, you know,
Yeah.
of insomnia, anxiety, irritability, bloating. There's quite the list that can happen.
Yeah.
And patients will kind of notice that it's only at that time of their cycle, it's affecting their daily life. And then when their period finally comes, or it feels like finally because they're dealing with these
Yeah.
issues, then the symptoms get better.
Yeah.
And they're feeling like, oh, everything's fine again. And then, which makes it hard for patients to come and ask for help, I feel like, because
Sure.
it's like, oh, it's just PMS.
Mm.
And, you know, you can kind of write it off, which a little bit of that, you know, the mood changes, if they're mild, these milder symptoms are it's going to be normal. It's
Yeah.
just from the fluctuation of our hormones.
Sure.
But if it gets to that point where, no, this is keeping me up at night, you know, I can't have my normal
Right.
day-to-day interactions with people. I'm worried about it, or I'm thinking about it. I'm dreading
Yes.
that time of the month. Those would be all signs that, right, we don't want you to settle. We want you to come in and see if we can do something about it and
Sure.
make life a little bit more manageable, pleasant.
Right.
Yeah.
We don't want people living their lives where 1/4 of the time they're dreading.
Yes.
Yeah.
And when you put it that way, it's like, okay, 25% of my life, right? That's a lot.
That is a
It adds
huge
up.
percentage of your
Yes.
life, and there are things that can be done to help, and we don't often think about it in that terms like that, like 25%, 1/4 of your life. If you are in misery, if you are in pain, if it is debilitating and you're dreading it,
Yeah.
talk about it, right?
Exactly.
Talk about it. Yeah.
Yes.
So, well, this has been a really helpful episode. And I think talking about hormones is helpful to a lot of patients. So thank you so much for joining us today, Dr. Braun.
Very
And of course,
welcome.
thanks for being here, Britt. And if you are interested in more episodes about women's health, please visit rochesterlocal.com/pelvisparty.